Do you have low testosterone and you want to do something about it? Well, I'm doing a procedure right now called hormone replacement therapy. And this is my doctor.
Hi.
And he's going to do a procedure and we're going to record it.
Hormone replacement therapy on Mr. Phillips. This is actually a repeat procedure. He's already numbed, and we're just going to go ahead and do the insertion of a pellet, which is basically bioidentical hormone replacements. It's basically made of soy and yam. There is a deficiency of hormones as we get older. Some people have naturally low testosterone. So there is a lot of anti-aging, a lot of benefits in testosterone replacement therapy. It helps you lose weight. It helps you become more muscular. People complain of mind fogginess. That gets cleared up. Of course, there's a lot of people that think it's just related to some erectile dysfunction, but that's not the reason. Overall, it's just a sensation of well-being that happens with hormone replacement. In men, of course, we just give testosterone alone, depending on the level that we need to achieve. As women also need testosterone, but they also get estradiol, and it's very beneficial in the long run. What other questions, Mr. Phillips, do you have on me? Anything particular?
How long does the pellet last?
It all depends how you use the pellet. For example, the different companies will come up with an individual study, and they will tell you. But in average, in a patient, we're talking about 5 months. Some people can prolong it to 6. So there's a cost involved, and I always want to be aware of the cost, so I keep it. It's basically geared to the patient. People that work in high stress, they utilize the hormone a little bit more quicker. They also need a little higher dose. So it all depends on the patient. The usual median effect of the hormone takes place 2 weeks. There are people that takes 3 to 4 weeks. Of course, there are always people that walk out of this room and they say, I feel great. That's, I think, placebo. But overall, an average is 2 weeks. We recommend you not to do any exertion for the next 3 days. And after 3 days, you can go back to your natural exercises. But I always tell people, once they get the hormone, to make the most of it, to exercise more. Definitely use weighted exercise, and you will see that you will be able to lift more weight and be stronger for sure. How did you feel on the first? How long did it take you to feel better?
About the same, about 2 to 3 weeks.
2 to 3 weeks.
Yeah.
And then you can feel
I
change.
I had my sex drive back. It felt great. I felt like a new man.
New man, indeed. So, and then there are people that will come every 4 months, and those are the people that are extremely stressful, and they just feel that the energy is coming back. So I always tell people, it's almost like the movie Matrix, that your information into your brain starts flowing, you feel more energetic, it's quite an amazing feeling. So 6 years ago, I had not read about it enough. So a friend of mine who does hormone replacement in Dallas, he was raving about it. He's an endocrine. He just said, you need to go on it. Even though my testosterone level is pretty good, because of exercise also increases your testosterone. So I just basically listened to him, did my levels, went ahead on therapy, and it was a game changer.
So people who have low testosterone like myself, the levels at mine.
Yours was very low, indeed.
Very, very low. Is it possible for them to do it naturally? Because everybody says, oh, you could do it naturally.
Not to that extent. So you will get to a certain level, but not to the level that you get with the replacement. So there will be exercises. There are certain food that we eat that are anti-testosterone. Avoiding those, there's a whole list that I can provide. But to get to this level, it's not possible. So this is basically it's natural products, but it's an amazing change that you will see. So yes, you can have some decent increase, but not to the level without replacement.
Yeah, I did it. Actually, it went from like 100 and something to 400 or something, but even at that level, I didn't feel.
Correct. So it will not. So like so insurances pay for the cream.
Yeah.
And the cream. So let's say you're below normal, which is normal. Let's say it's a range of 300 to 900 for your age.
Yeah.
So the cream will be allowed. You'll have to do 2 testosterone levels fasting because because the diurnal variation in the testosterone, and you below 300, so they will give it to you, but you will only go 350, maybe 400, and then you have to put the cream every day, and you will not get the amount, the rate of testosterone the way we do it with the hormone replacement like this. As you can see, it is a pretty simple procedure. Ice pack is because I make a little pocket in his flank, so decrease the swelling. There's no pain. Initially I numbed it, which we didn't put in the video. You can just see we talked about it while we did the procedure. He didn't feel I was in there. Pretty comfortable.
Oh yeah, pretty comfortable.
All right.
All good.